My name is Aderayo Akisumoye. I'm a FMP student and I will be completing a head and neck assessment on you today. Can you tell me your name and your date of birth?
James John 1989.
Thank you so much. So before we start, I will have you read the disclosure. I will wash my hands and do a 360-degree scan of the room, okay?
Okay.
Thank you.
I, James Jones, voluntarily give Maryville University permission to record my image and voice and grant Maryville right to use this recording in the medium for educational purposes. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Thank you. Thank you so much. So now we're gonna go ahead and start. We will start with the cranial nerve assessment. I'm gonna start with the cranial nerve 1, which is the oculomotor nerve, which tests the sense of smell. Okay. And we have you close your eye, occlude one of your nostril, and smell. Tell me what you smell.
Vanilla.
The other eye.
Vanilla.
Thank you so much. So the cranial nerve 1 is intact. Then we go ahead and assess cranial nerve 2, which tests the optic nerve, which tests for visual acuity and also the peripheral vision using the confrontation test. So let's do the visual acuity test. And we have you occlude one of your eye. Then you read the last line on the Rosenbaum chart.
LTFPH.
Thank you. The other eye.
LTFPH.
So the visual acuity is intact. Then we're going to be testing the peripheral vision, okay, using confrontation test. So you look straight into my eye now, okay? So you will tell me where you see my finger, okay? Look straight into my eye. Tell me where you see my finger, okay?
Now.
Awesome, okay?
Now.
Awesome. So the cranial nerve 2 is intact. So we're going to go ahead and assess the cranial nerve 3, which is the oculomotor, cranial nerve 4, trochlear, and cranial nerve 6, abducens nerve, okay? Which tests for the extraocular movement of the eye using the 6 cardinal feet of gaze, okay? So we have you look straight into my hand. You tell me whatever you see, it, don't move your head, okay? Just go with it, okay?
Okay.
Good. Back to midline. Back to midline. Back to midline. So there are no strabismus, there are no nystagmus, there's no involuntary eye movement. So in your case, everything looks good. So we're gonna be assessing cranial nerve 5, which is the trigeminal nerve. So I will have you clench your teeth for me. Good. So I'm testing for the strength of the nerve. So I will open your mouth towards resistance. Perfect. Cranial nerve 5 is intact. We're gonna be assessing cranial nerve 7, which is the facial nerve. I'm checking for the involuntary eye movement. So I will have you smile big for me. Good. Can you frown? Pop out your cheeks. Awesome. So there is no drooping. There is no signs of any strabismus. So everything looks good. No facial drooping. So everything looks good, meaning facial nerve 7 is intact. I'm going to be assessing cranial nerve 8 using 3 tests, which is the whisper test, Weber test, and the Rene test, okay? I will have you occlude one of your ear. Good. So I'm going to whisper a word to you. Tell me what you hear, okay?
Apple.
Perfect. The other here, please.
Baseball.
Thank you. So the whisper test, your hair, it says everything looks good. So we're gonna be doing the whisper test right now. So I'm gonna be using it with this tuning fork. You will tell me. I put it at the base of your head. You tell me when you hear the sound. Tell me if it is one ear or both ear.
Both ears.
Okay, you can hear both.
Yes, both ears.
Awesome. Thank you. Then we're gonna be doing the Rene test, which tests for ear conduction and bone conduction. You tell me when you can no longer hear it again.
Now.
Okay.
I can hear it.
Good. So I'm gonna be testing the other ear too. So you tell me when you can no longer hear it again. Okay.
Now.
Right now.
Now I can hear it.
Awesome. So meaning the cranial nerve 8, which is the vestibulocochlear nerve, is intact. Now I'm gonna be testing for cranial nerve 9 and 10. Now we have you say ah.
Ah.
Awesome. Then I'll have you swallow. Awesome. So cranial nerve 9 and 10 is intact. Then I'm gonna elicit for the gag reflex. Okay. So I will have you open your mouth. I wanna, as if I'm dipping this thing into your tongue. So I'll have you see the reaction. Awesome. Good. So that's the gag reflex. It is really, really perfect. Now cranial nerve 11, which is the accessory nerve. So I will have you turn your head up and down. Good. Awesome. Then shrug your shoulders towards resistance. Perfect. Then the last one, which is the hypoglossal nerve, I will have you right now. I will have you stick out your tongue, move it left and right, so everything looks good. that concludes our cranial nerve assessment. Then we're gonna start with the head. So with every assessment, we're gonna be starting with inspection. I'm gonna be inspecting the head right now to see there are no deformity, no mass, no lesion. Then also palpating to feel for any contour, any depression or any deformity. In your case, everything looks good, it is symmetrical. I'm gonna go ahead and assess the face. Okay, now I'm gonna check for any involuntary facial movement. I can see there is nothing, and I'll be assessing the frontal sinuses, any pain or pressure.
No.
Then also the maxillary sinus, any pain or pressure.
No.
Awesome, everything looks good. Then I'm gonna be checking for your eyelids, then the eyebrow. Can you open your eye? So everything looks good. There are no crossing of the eyelid or eyebrow. I'm gonna be checking the lower eyelid right now to check for the conjunctiva, which is pink and not pale. Then now we're gonna be checking for the inner structures of the eye. Okay, so I'll grab the light source right now. Now I'm gonna be testing to make sure the pupil reaction to light. So I will shine it direct. Yeah, it is symmetrical. Good. So while I have my light, I will have you look straight into the light. Good. So I can see that the pupil is reacting to light. So when I shine my light to the left eye, the right eye should constrict. When I shine it again into the right eye, the left eye should constrict. So when I shine it into the right eye, left eye should constrict. When I shine it to the right eye should constrict. So the pupil is equal, round, reactive to light. Then I'm gonna be checking to see how it accommodates. Can you look at my hand right now? Then look at the near object. My hand, also the near object. So the eye is reacting and it's constricts, the pupil constricts to near object. So everything looks good. We're gonna be assessing now the nostril. Okay, so we're gonna be doing the fundoscopy exam. So the fundoscopy exam, I want to assess for the inner structure. So I'm gonna be assessing the inner structure of the eye. Okay, so we're gonna be doing this okay, for the red reflex. Awesome, you're doing well. Yeah, the eye is good. I can see the fovea, the macula also, then also the other side too. Okay, perfect, everything looks good. Now I'm gonna go ahead and assess the nostril. Okay, so the nostril, I want to palpate and inspect to see if there's any lesion, any swelling, and for symmetry, everything looks good. We're gonna be checking for the inner structures of the nostril, the nasal septum. So I'm gonna get an otoscope to check the inner structure. Okay, so now I'm gonna have you list your. All right, so everything looks good. The nasal septum, everywhere the mucosa is pink and not red. There are no polyps. Yeah, there are no lesions or any swelling in the nostril. So everything looks good. Now I'm gonna go ahead and assess the ear. So the ear, the pinna looks soft and there's no drainage. Then we're gonna be checking the inner structures. Any pain?
No.
Okay, so the inner structures of the ear, I'm gonna pull up and back, up and back. So the tympanic membrane is fairly gray, translucent, and with visible landmarks. So also to check the other one, perfect, the same. There are no swelling, there are no impaction. So everything looks good. And then I'm gonna go ahead and check the mouth right now. The lips is good, is moist and not cracked. Then open your mouth for me, please. So to check the inner structures of the mouth, I'm gonna put on my gloves right now. So I'm gonna check for dentition, the soft palate. So there are no lesions. Can you lift your tongue up for me? Good. And also the soft palate, the uvula, the tongue. There are no swelling, the gums. Then there are no dental caries. Everything looks good in the mouth. Then I'm gonna go ahead and assess the neck. So with everything, we're gonna inspect to see there are no lesions, so there are no swelling. Then I'm gonna go ahead and palpate for the lymph nodes, the pre-auricular, the post-auricular, the tonsillar right here, then the submandibular, the submental, the superficial cervical right here. Yeah, then also the deep cervical. Can you go this way? It's not usually felt, but when you turn it right now, you can feel it down. Then you see the posterior cervical right here, then supraclavicular nerve right here, then also the infra right here, then also the occipital at the back of the head right now is right here. So you're feeling for the lymph nodes, then also to check the thyroid gland. So the thyroid gland is good, the trachea is midline. So that concludes our head and neck assessment. Thank you so much for your participation. Thank you.